At the minute I have vascular dementia, MS and fibromyalgia, and I've got children who live at home with me. My youngest is 7, and on a daily basis they help me. They're helping me with my life. I can't remember things. I get a lot of pain, fall over quite a lot. So they actually help me and go along to a lot of my health appointments so that I can remember through them. They'll come home and they'll tell me what was said later on. And quite a lot of times, even my children have noticed that whenever you ask a question about the dementia, some of the health professionals will automatically switch to talking about the MS. They really don't want to talk about dementia at all. And I don't know whether they're just not aware of it or whether they're not used to dealing with somebody of my age with it. Or does everybody get treated in that way? But I find it it's very disheartening, and it means that you come out even more confused than what you went in. And the children get affected by it too, because they obviously need to know the answers, because they're the ones that are my carers. And if they're not being told the answers and how to go about looking after somebody with dementia and treating them with respect and care, how are they going to know?
Liz and I moved in here because Liz developed Alzheimer's at 47, and we came here because it's independent living, and I can go through my wife's journey through Alzheimer's by living here. I can live independently as much as possible. Okay. She used to come out of the shower forgetting to rinse maybe the shampoo off, and she thought she'd rinse the shampoo off. So this process is now, I have picked the showering because I would hand her the shampoo, tell her to rinse the shampoo off, put conditioner on, and then put shower gel on, because she just came out of the shower and she thought she was finished, and she wasn't.
Northern Ireland Social Care Council is the workforce regulator for the social care workforce across Northern Ireland. So people who work in nursing home, residential care, domiciliary care and daycare are regulated by us, and we set standards of practice and conduct for them. I think the framework will be a very useful addition to the skill set and knowledge set that's required for good practice in social care in Northern Ireland. People who work in social care will encounter people with dementia and their families on a regular basis, and they will be providing care and support for them on a regular basis on a range of settings. It's important that they have the right skills, the right knowledge and the right competency to be able to respond effectively to their needs and ensure that the services they deliver are of a high quality and are focused on the needs of those people. So I think the framework is a really useful addition to our ability to be able to develop the skills and knowledge of the workforce.
Good afternoon, ladies, and welcome to the Clinical Education Centre. So you're all here to learn about dementia care.
My name is Martina Meenan, and I'm one of the nurse education consultants in the Clinical Education Centre. My background's mental health nurse teaching, although within the Clinical Education Centre we cater to not only nurses but also allied health professionals. So it's nurses, midwifery and allied health professionals within the Clinical Education Centre. My background would be mostly mental health but also dementia. It ensures that our programmes are very focused on what we need are the aims and learning outcomes, and really focused on the tiers. For example, if it's an introductory programme that we need, a brief awareness, right up to advanced or specialist type of programmes. So it ensures ease of our stakeholders. It's easier for them to actually interpret their needs.
This is a learning development framework that is specifically for dementia. And I know that you have expressed wish that you would like to specialise in working in the field of dementia care.
Oliver has just completed his nurse training, his mental health nurse training, and he has also been successful in getting a permanent position here in the Gillis Memory Centre. He's very keen to develop his career in the field of dementia care, and I felt it was useful to use the framework for him to look at, to see areas that he feels he's developed in and areas that he feels he needs further development in. And also it is very dementia specific, the framework, and I felt it would be a good tool for him. And as indeed we have all multidisciplinary team here in Gillis Memory Centre, occupational therapy, physiotherapy, social work, and I feel the framework will be useful for them as well at their KSF and their professional development meetings, where they'll be able to very clearly, using the framework, identify areas that they feel they need further development. And in relation to that, then it allows me and my team here as managers to be able to find out what training is required, and then obviously as part of the planning and the training strategy and the trust, we'll be able to put forward the requirements that people need working in the field of dementia care.
You'll remember a few weeks ago we talked in the team meeting about the Dementia Learning and Development Framework. Our team meetings really are about planning our work for the week ahead, possibly for the day ahead, for keeping everyone up to date about service developments. We'll have 11 permanent staff on the team and some temporary posts at the minute, and we're a mixture of social work, nursing, support work, occupational therapy and psychology. The framework's designed to support learning organisations, and in terms of planning dementia training, I think all of the content of the learning and development framework and the learning outcomes that are there, they can be used almost as a checklist to check that you're hitting on all of the key areas in your training. The self-assessment tool in the learning and development framework can be used during that process, and it's very dementia specific obviously, and I think that will be helpful.
This framework will help me immensely across all the areas and all the sort of levels of staff that we have at Palmerston. So whether it be from the housekeeping staff to the frontline carers, going through to the seniors as well, and right up to my deputies, because it actually gives us that development where they can actually look at it and see their journey and help map out what extra courses that they can do whilst they travel through the different tiers and through the thematic areas. Our staff need to be fit and understand dementia so that they can enter into those realities, whether it's just basic training through to learning about the environment, to all the different therapies that are out there. And it's very rare that you would actually find somewhere as a manager in one document where you could actually go to. So it will take loads of time from me searching the internet, having this all in one place.
With Four Seasons Healthcare, we provide both nursing and residential care across Northern Ireland. So we do have a very broad range of staff. So the framework is really easy to follow. We can look at the different tiers that we can adapt to each individual staff member. The thematic areas are really good because we can identify what nursing staff need to do and what our ancillary staff need to do in order to enhance their knowledge in dementia care. So the themes that we have throughout the framework really do benefit all the staff that work across our care home sector.
All of this is of course about our service user. Fully involved, the programmes that we teach within HSC Clinical Education Centre incorporates fully the views of the service user, and as far as possible we try to keep the service user at the heart of our programmes, and of course that's what it's all about at the end of the day, the patient with dementia.
In my training, there was never anything dementia specific. It's something that you learned along the way, and whenever you became if you were doing courses and things, you had to find out what was specific for dementia. I welcome this document very much because it is dementia specific. It's broken into tiers that you can use with all disciplines and all grades of staff.
To me, knowing that they'll have the knowledge to treat my wife with dignity and give her the care that she needs throughout her journey off Alzheimer's, that to me is a lot of peace of mind, and that's why I liked this framework. So I was proud to be part of this framework. So it was.
The framework will set out new guidelines of understanding, taking away the stigmas, and that will mean better patient care in the long run. If I had been offered the help that's in that manual whenever I was first diagnosed, I wouldn't have spent 2 years sitting on my own wondering where to go and what to do.